everyone, this is your host Rohan Tandil from InnoHealth Magazine Studio. I welcome you to this podcast produced by InnovatioCuris with a mission to spread awareness and knowledge of various facets of healthcare innovation. This podcast is seventh in the series Voices of IC Innovator from InnoHealth Magazine, the first magazine in India on healthcare innovations. In this series, we would be exploring the essence of the IC Innovator Club through its club members' perspectives. Today, we are going to have a conversation with our guest speaker, Dr. Sanjay Sharma, who has over 18 years of experience in providing healthcare for the masses. He completed his master's in general surgery and pursued his further studies in podiatric surgery in the US. He is also an alumnus of the IIM Bangalore and the University of California, Berkeley. He has completed MDP programs in healthcare management, hospital administration, health economics from IIM Ahmedabad and AIIMS New Delhi and World Bank respectively. He has contributed vastly in the healthcare industry. To name a few, he is founder of Apta Food Secure, co-founder of Yostra Labs Private Limited, investing in futuristic healthcare companies, etc. Also, the Times Group and Government of Karnataka felicitated Dr. Sanjay as a rising star in the Time Healthcare Achievers Awards in December 2019. Food Secure was also awarded as the best podiatric clinic chain by the Indian Today Group. Dr. Sanjay is one of the few podiatric surgeons practicing in India, and his main work is in diabetic foot care, wound management, and sports injuries. He's trained extensively in foot orthosis and offloading custom footwear. He has been a speaker in various national and international conferences and off-late webinars. He's an avid traveler, tracker, and theatre artist. Welcome, Dr. Sanjay, to our podcast. How are you today, sir?
I'm good, Rohan. Thank you for the generous introductions.
So now coming to the podcast, let me elaborate on the flow of this podcast. I'd be asking you a series of questions and we may discuss your views and opinions on it. So let us begin. So as we know, we grow in our career with the help of various experiences, be it good or bad. Those experiences bring in some important lesson. The realization of such a lesson depends on the person. So my question to you is, what is the one thing or that one lesson that you wish you knew at the start of your career? Or say, you made a realization of it after many years and would have preferred otherwise?
So, just after my graduation, probably I started my first venture, which was into an integrated healthcare. Probably it was too early in that time, and today, if it was today, then probably it would have been the right time. So when I started on the integrated healthcare, where all the systems of medicine was practiced under one roof. So, that was the beginning of the career just after graduation. And we had that vision that a patient needs to be treated for the condition that he has and as a person, rather than a system treating him. He should not be going around from Ayurveda to Western medicine to alternative systems like acupressure or Reiki or pranic healing, things like that. We should have something where we know that it has to be, what works in which conditions the best, and then give appropriate advice. So one learning from that, I would say two learnings from the early career things. One is when I started this venture, I was like, wow, I'm the owner of this, or I'm the one of the directors of the company, and I need to be sitting in that director's chair and managing everything sitting inside. So that was the idea that I had. And when we took off this venture, I obviously didn't go well at that time. At that point of time, we had to move it into a different sector altogether, and I had to come out. But one learning or the struggle during that struggle period is, I need to be in the forefront, not sitting at the back and trying to manage. But, you need to sit at the reception. You need to start interacting with your customers day in and day out, or what we call as patients day in and day out, and not just sit at the back and direct your employees on what to do. So if you do not have your first-hand interactions with your patients or with your customers, then not as a doctor, but as the owner of the company, on what are they feeling, and to be at the reception or the front desk is something that I learned was the key thing. And second one was, you need to have an idea whose time has come. It cannot be too early or too late in doing something. So these were the two lessons. Or the first one is a major learning for me, which I have implemented it all through going further.
Coming to the next question. Through our life and career, we use many things as stepping stones to grow and develop to the ideal personality or role that we want to play in our future. Some of us enabling us to take a major leap due to its deep impact on our minds. So my question to you is, what are the resources that had a major influence on you as a professional or as an individual?
So, in the professional version or the aspect perspective, for surely as an individual and the professional, the first influencer was my father, where he never said no to anything, any opportunity that came by, and always, he did things what he thought it was appropriate to be done at that point of time in terms of his ventures, even though he was a professor at ISC. Once he came out, took a VRS, came out of it. He did a lot of failed and successful projects, ranging from industries to agriculture, and he still keeps thinking about various ventures even at the age of 83. So I think that was my first influencer in terms of never say give up and always move forward. There is always something that is available that can make you successful or make you happy and worth a living. But apart from him, which I think would be for most of us, we will have our fathers or someone in the family who would be influencing. I would say there was somewhere in the mid career when I was working in Punjab. I was working with a family business who owned a hospital there, and I was gone. I was taken from I literally taken out from Bangalore and then planted in Punjab to revamp a hospital or so as to say get it going again. So this hospital was under locks and keys, I would say, and it was non-functional, just about an OPD of about 30 with 100-bed hospital, everything, shut down, the IP and everything shut down. So I was there for about 2 years trying to completely revamp it and then make it a completely functional hospital. And there were obviously someone as young as me going down there and young then, not now, going down from all the way from Bangalore to Punjab and trying to manage the existing doctors and trying to revamp the whole hospital was questioned. And there has always been a complaint. So whenever this owner of the hospital used to come from Delhi to kind of supervise once in a month or once in 2 months, my associates or someone whom I was working with in Punjab always had a complaint that Sanjay is like this, Sanjay is like that. He's not happy. He's not getting this done. That is not happening correctly. He did not do this. So there was a list of it. And though this owner of the hospital who used to come down used to tell in front of the everyone, saying that Sanjay, you should have done this, you should have done that. And I was like, no, why is he, putting it on me? Because I have every day almost I have reported it back to him, and then he knows what is happening on a day-to-day basis. But when he comes in once in a month, he kind of completely ignores that updates and say that you should have been doing that, been doing this. And when I asked about it on a private note, saying that you knew about it, but you still are telling me what you should have done it the other way. So he said, no, it's important that you have a phase or a perception amongst the crowd that you are taking some action, even though that action might not be implemented or might not be relevant, but it should feel that the owner is taking some action when he hears a feedback. Otherwise, they think that this is not working, and they might go to someone else to air their grievances. To ensure that we get to hear all the grievances, you need to give a perception that the action is taken. So that's something that I learned from this owner of the hospital. It's a big group who was running this hospital, and these small instances during the carry. This is one of them that I told. Always, did a lasting impression to build it. So when we start working today, we know that how much an action on a feedback is pretty important, or a perceived action on a feedback is pretty important.
Moving ahead, talking about careers, Many people face various hardships. So I'd like to know some of the hardships you faced in your career and how you found inspiration from such situations.
So I'll go back to the same, instance when I was working in Punjab, because I think that was the one which kind of changed my, career option itself. So as you know, I was a doctor, finished my my graduation in Bangalore, post graduation in Pune, and as usual for any doctor per se, it was looking at practice and probably working in a hospital, working in a medical college. So these were the career options in front of me at that point of time. Never thought something beyond it. So that's when I got this opportunity to kind of head the hospital, go there and revamp it. But it was not an easy task. One is going all the way from Bangalore to Punjab and kind of working there in a hostile environment per se. And there were challenges in terms of where the management or the owners of the hospital wanted to make a huge change in the working of the hospital. They had a vision, the mission, and it was lofty vision and missions. But the local administration who were on the ground didn't think that anything of that mattered. What mattered was for them was to ensure that their interests are safeguarded, and so there was challenges in terms of where I had to lobby, mediate between this local administration, the staff of the hospital, and then the owners of the hospital. And it did was a challenging task. It went on to where the locals of the hospital even sealed my where I was living. I had to call the police to open the seals, and I had to interact with a lot of politicians introduced by the owners to ensure my personal safety and the safety of the people whom I had hired there. So the learning was how much talking to people, ensuring that your stakeholders, your opponents, and your friends are all on the page that you would want them to be, and interact with them, and how management actually works. It is not about sitting in a chair and say that I'm managing an organization or managing a thing, but I learned exactly what management is and what needs to be done, how things has to be handled, and I think that was the direction change that we had, where I came back from Punjab and started my 1 year program at IIM Bangalore as an executive MBA to kind of learn the jargons around. But that was one of the instances of the hardships that I would say I still remember, and and today I would. It doesn't look like a hardship. It was a huge learning for me in terms of how do we manage an organization, how do we manage people.
Moving ahead, besides your current profession, what profession would you like to explore?
Interesting questions. If I was not at that point of time, probably the choices when I finished my +2 was majorly the engineering and medicine. We hardly knew anything else as a career option, because if you have scored pretty good in your entrance exams and your +2, then you had, it's not you had to, but that was the two choices that was always recommended. But if I had seen various options as in one there today, I would have probably loved to a travel a blogger. Would have loved to travel across the world, documented. I would love archaeology and history and trying to know what happened in that world in the past. Probably I would have been doing that, going around the world, documenting their histories, documenting their food, the cultures, and probably talking about it.
Going ahead, what makes you feel your best self, rejuvenate you from the daily workload and stress?
I consider myself more of a workaholic. I don't see stress in if things are pretty smoothly going on at the work front. But considering I do take about 15 to 20 days off for my trekking in the mountains. So that's something, a complete stress reliever from a long term perspective. would just go probably a solo trekking, not with the people around, and go to some unheard of destinations and then come back. Would I would say that is the stress buster for me. Not on a daily basis, but for surely once or twice in a year.
That's nice to hear, sir. It's not necessary that we should be stress busting every day and maybe utilizing our time often on our work. Moving ahead, talking about the IC Innovator Club, I would like to ask what it means for you to be a member of this club.
It's been an enriching journey as such. It was in one of the conferences that I was invited by the IC Innovators quite some time back that I enrolled myself as a member. Even though the place I live in Bangalore and the Innovators Club is majorly in Delhi and most of the activities happen in Delhi, but I get to know what has been happening across the world, across India in terms of the innovations that has been happening and the kind of impact these innovations has been creating for the public at large, especially in the healthcare domain, and the people involved or who's part of the IC Innovators Club, even I would say it would be VK Singh or Sachin or even all the members are absolutely someone I would look up to. Each of them bring in their own aura and their own intelligence, their own innovations onto the table, and being committed to the public good. So that's I feel it as a privilege to be a part of the club and being informed about the activities. And at least these days with the COVID end, things have been more virtual, where I would have participated in a couple of events that they have conducted. So it's been really a privilege, I would say.
Moving ahead, I would like to ask what are the functions that this club performs and how does it help a member to grow as an individual?
So, as I mentioned for the last question itself, there is a lot of events that happen, or a club meetings that happen, where we discuss about a lot of undiscussed things, usually in the conferences. And these things aren't this nuances of innovation, nuances of what it takes to bring those innovations to the market. What is the new things that has been happening across the world, where we need to keep abreast of. So these are the things that gets discussed in these meetings. So I think this is what makes it a huge difference, being a part of the IC Innovators Club rather than just any other club or conferences.
For my next question, the definition of innovation differs from person to person. So what I would like to ask is, what does innovation mean to you, considering the healthcare industry?
For me, innovation is not something that we invent research something and invent, which can be in the stables for a long time. Innovation is something that we implemented right away at the earliest and ensure that it either reduces cost or increases efficiency in providing healthcare. So it is, right now, reducing costs, increasing efficiencies. So these three, if it meets, then that's an innovation for me.
For my last question, where can our listeners connect to you, sir?
They can always connect to me at sanjay@foodsecure.com. That's my email address, sanjay@foodsecure.com. And happy to respond to any of the emails. You can always connect to me on LinkedIn and Facebook too. Just search for my profile, Dr. Sanjay Sharma.
The link to connect with our guest, Dr. Sanjay Sharma, will be down in the description. Thank you, Dr. Sanjay, for joining us on the podcast.
Thank you very much, Anand. It was a pleasure speaking to you.
I would also like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast ideas or recommendations. You can also connect with us if you have a healthcare innovation journey of your own to be a part of a podcast series. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Rohan Tandil from InnoHealth Magazine Studio. Thank you.